Welcome to the Johns Hopkins Women's Health Podcast, A Woman's Journey, Insights That Matter. I'm Kelly Gear-Ripken, and I invite you to listen to Johns Hopkins specialists discuss the latest topics in women's health. Now here's your host, Lily Shockney.
Hi, this is Lily Shockney from A Woman's Journey at Johns Hopkins, and this is our podcast, Insights That Matter. Today we are joined by sex therapist Kate Thomas, Director of Clinical Services, the Sex and Gender Clinic at Johns Hopkins. Welcome, Kate. Thank you for coming.
Thank you for having me.
One of the things that I've heard, and I want to know if this is accurate or not, is that approximately 1 in 10 women experience a decrease in their sex drive at some point in their life.
Let's see. This is a difficult question to answer because I hate to start out the podcast with something that's more depressing than that. And that is that many women, if not all or most, experience a decrease in sexual drive, and I'm going to slash that with interest, and I'll explain that as we go along.
Okay, and that makes sense. Certainly does make sense to me as a clinician. Maybe someone was being optimistic when they said 1 in 10. What are some sexual roadblocks that a woman can encounter throughout her lifetime?
Well, there's certainly many, many, many things. They run the gamut between physiological, personal or psychological, and sociocultural and relational. So just to name a few things. Certainly biologically, we have our ups and downs. There's even some data on what menses and that menstrual cycle do, and certainly at menopause, where hormones significantly change. We're going to see changes from that reason. Also, other kinds of health problems as well. Almost anything, even arthritis. Interestingly, although it doesn't do anything directly to the sex drive, but because it's painful, people avoid. Then we get into psychological reasons. Certainly depression would be huge, but other kinds of things, self-esteem, body image. We go into cultural messages that women get about sex and what's sexy. Even older women often think we're not sexy because only younger women are, those kinds of things. Could be ethnic or religious issues as well. And lastly, certainly and hugely is relational issues. And that goes all the way from having, and I'll explain this later too, but having a good relationship with someone could also be, in some ways, we can decrease our sexual interest just because we have a good relationship, but also certainly relationship issues, where there's anything. I just worked with a couple this morning that had infidelity, for instance, and that's created certainly a difficulty in their sexual relationship. Or it could be resentment at our partner, anger, any number of things. It's a long answer, but that's the truth.
Yes. In most cases, women usually outlive men, so she will be a widow and may not want to embark on a new relationship for whatever reason.
Absolutely, absolutely. And we see both of those. We see women who just stop even trying to be sexual or meet a partner, others who continue maybe a self-sexuality life or even attempt to find new partners, especially with the advent of the dating sites.
Yeah, and once a couple starts having children take up 99.9% of someone's waking hours and sleeping hours, which certainly can make it difficult to grab that time or even plan for that time. I want to go back to body image because I worry that children are being taught through society at an early age what they should look like. And they'll strive to do that when I would prefer them not to. Any advice for parents in counseling and spending time with their children so that they're not fixated on body image and wanting to look the perfect way, however that they think perfect is? Certainly
for many, many years, media has dictated a lot of what we see as physically attractive, and young people are particularly susceptible to that. But we all are to a certain extent. What's interesting is in our society, as much as we're kind of repressive in a way, at the same time we're sort of sexually out there, lots of sexual images. But what we see in the media are these perfect bodies. So if we see nudity at all in our lives, we see perfectly formed nude bodies. And then we look at our own, or a young person looks at their own, and they don't look like that. And
Right.
so, that creates, is the advice to have a nude society? Maybe not. It's a little cold, but nonetheless.
Tis an option.
Yeah, it is an option. But nonetheless, we do want to be aware that we can probably help that along by giving people adequate information, because kids are not well sex educated. And we think of sex education as, sexually transmitted diseases, how to prevent them, pregnancy. But we don't talk about sexuality. We don't talk about our own sexuality, how sexual we feel, and those kinds of things. So I think that parents and others can do a lot with young people to help them to feel good about themselves. And there's lots of readings and things like that out there now that kind of encompass that, and some YouTube videos, and there's lots of resources that parents can find to kind of help them with that in pursuing better body image.
So the HPV, the vaccine that is now thankfully available, and that we're trying to encourage parents to have their children vaccinated. Initially, it was children 11 and 12 and up, but now that's been lowered to the age of 9. And I've wondered, how do you go about explaining to a 9-year-old why they need this shot? What is this shot for? Thoughts on that? And have you had any parents come to you and say, I don't know what to tell my child? Or I imagine some people are probably just saying, it's a tetanus shot.
Probably.
Or a flu shot, right?
Probably.
And not
probably.
going into any discussion because they're not comfortable doing that.
Sure. It's too bad. I mean, I'll tell you what I think the ideal is, but then, parents are enculturated and raised in the same society we all are, so they're not necessarily any better at these things than anyone else. But ideally, the recommendations are to start sex education as young as 4. And there are excellent resources for doing that, where you really begin to talk pretty honestly about loving relationships. You can couch it in the ways that you want it, so that by the age of 9, with kids starting puberty sometimes, much earlier than that, you really do behoove ourselves to do some really good sex education. If that's been in place all along, kids don't take it as such horrific news, because a lot of 9-year-olds don't want to face yet puberty, especially if they haven't started, and all the changes that it means. But nonetheless, we've had a history of teaching them. We can encourage parents to utilize, materials and things of that nature when they're not so comfortable talking with it. For instance, giving a child a book and then discussing the book with them, that kind of thing. I think we might get a long way.
That's wise information. When we're looking at children in elementary school, middle school, even perhaps early high school, girls are paying attention to one another. Boys are too, but I think girls in particular are looking to see who's developing breasts, who isn't developing breasts. They're very distressed if they're in the group that is not, as they feel, progressing. And some kids are cruel. They say such hurtful things that I wish their parents were there so that something could be done about it. But children may go home and not tell their parents what happened that day. But I think it is a form of bullying, quite frankly. But how should we go about talking to children that are before puberty, what's going to happen to their bodies, and that it doesn't happen to everybody at the same time?
Yeah, I have a couple of thoughts about that. I mean, certainly this is a really tricky period of time. It always has been. And since puberty for girls is generally speaking between 9 and 15 that they start. So we have a vast range of where kids are in those age ranges. And therefore, you have a girl who looks like a little girl and another one who looks like a voluptuous woman in the same age group. Those things are very, very difficult to traverse. But we go back to, I think the only way we have to help people out of it is education. I'm now in my 70s, but even when I was a kid, we went to the movie about having our menses. We went with our mothers. It was Kotex produced it back in the day. And we all went to that movie, and they just basically talked about our periods. But think about having a class which was with girls, or a group that was with girls where kids talked about these things, not just having your period, but all of that kind of thing. What's really stressed in good sex education, and it happens in many more often private schools than public, is sex education where they really do have forums where kids talk about their concerns and what's going on. And that could be a way of understanding and limiting. And if we don't have opportunity to that, of course, it goes back to the home. And again, trying to help parents to teach their kids that we're going to be all over the place. If you're lagging behind, you'll catch up one day, and all of the above. So, So,
Wow.
But I think education's our only hope.
You mentioned that you were counseling a couple today, and a relationship can last a few months to hopefully decades. I think there's a lot of reasons why things fall off the dinner plate per se, but are there some recommendations as to how to, I'm going to say, keep love alive?
Mm-hmm. Good question. Very good question. Yeah, I mean, we certainly know, I alluded to earlier that in good relationships, sometimes people lose interest in sexuality. And that sounds terrible, like that's a terrible thing. But what I mean by that is that for all of us, the familiarity with being sexual with the same person over time, causes real interest and desire to dwindle. And it happens really across the board. And you mentioned the birth of a baby. We know that after the birth of a first child, sexuality goes down and never returns. Maybe you're having sex 3 or 4 times a week, you have a baby, maybe you're lucky to get it once a month, and maybe it'll even out to be every couple of weeks, but it never goes back. So there's a lot of, factors there. What we suggest to people is the number one rule, I think, in sex therapy is schedule sex. Schedule it. And what we mean by that is it sounds so unappealing in so many ways. What about spontaneity? But we find couples who've been together for long periods of time, they'll say, we want to be spontaneous. You'll say, well, when was the last time? And they said, 6 years ago. So, we can't wait for spontaneity. And we find, if you look at the research over time, long-term couples who continue to be sexual in their 70s, 80s, and 90s beyond are people who've had a regular sexual life. They kind of set aside, usually it's about one day a week, a couple hours or an hour once a week, and continue to do it. Those couples who continue to do it don't lose that.
So it's what you don't use, you may lose.
Absolutely. In sexuality, that's absolutely true. I mean, even physiologically we do, especially as we get older. Women who continue to have, vaginal penetration or utilize vaginas, actually their vaginas stay healthier than they might if they stopped having sex. It's one way to prevent some of the changes of aging. So, yes, absolutely. What we find is if couples have gotten far away from it, it's really hard to get them back to it. But if we keep them going, that really helps. And then, there's plenty of ways to build in fun. I mean, one thing is to help each person find their own sexuality and what feels sexy and good to them, even if that exists in fantasy. There's all kinds of ideas, obviously, of changing it up now and then, doing something different rooms or hotels. I mean, all those sort of tried and true things can be helpful at times. But most of us, our sex is going to be pretty much routine, time after time after time. But if we know that we feel closer afterward, we can work on people to not have things like sexual pain. We want them to have the ability to have orgasm. I feel like for women, orgasm is the hook often. We say, well, I don't have a whole lot of spontaneous desire, but I know when I get engaged sexually, I'll get aroused and I'll have an orgasm and I'll enjoy it, and afterward I'll feel closer to my partner. Those are the sorts of things we want to be realistic about what we're going to do. There's a couple in Washington, D.C., the McCarthys, Barry and Emily McCarthy, who say, in my field, good enough sex. Good enough sex. And not have to have everyone be mind-blowing. Yeah. And if that's our expectation from media, then we're always going to be disappointed.
Right. And it is all about expectations. Expectations of yourself, of your partner. I think oftentimes people wait till it's time to go to bed, and they are already tired. And they think they've got just enough energy to do this, but it doesn't happen for one or for the other. So I think time of day, and I like the idea of scheduling it, having a date night, not getting overly full when you go out to dinner or wherever that you're going to have that date night. Maybe having children over at grandma's house.
Exactly.
So that you don't hear somebody crying in bed and have to leave your room and not come back and resume anything. It sends a message that this is important. This is part of who we are. Yeah. And it should be.
Yeah, we stop prioritizing it, and this is a way of making it a priority. And by the way, we could also have date mornings. A lot of people enjoy having sex in the morning or late morning or, sometime in that where they have more energy, especially as we get older.
Yeah. So increasing intimacy, we've talked a little bit about men being different than women and vice versa. I saw one time in a presentation that was done at our breast cancer tumor board on sexuality and intimacy, and one of the PowerPoint slides, which I wished I had asked that individual to give me that picture because I thought it was wonderful. There was this wooden board that had maybe 50 to 60 different size and shaped buttons on it. And then over here was a board that had one button.
I have
on
the
it.
slide if you want.
Do you? Oh, good. So this is the man's board, and this is the woman's board, because she's thinking right in the heat of sex. She is thinking, did I remember to turn the dryer on when I put the clothes in? Oh, I've got to remember to take that food out of the freezer, or it won't be thawed for tomorrow night's dinner. Now, does Bobby have band practice tomorrow, or is it the next day? Mm-hmm. And of course, that man didn't think about any of that. Even if you asked him to think about it, it's not going to happen. He's on one mission, and that is that. Are there ways to help women get rid of some of their buttons so that they can look more like that one button?
Sure, absolutely. That's a very good question, because it's absolutely true. I mean, if you think that, at least physiologically, we know that men have many, many times the amount of testosterone than women. If you measure, it's 300 to 900 nanograms per DL, just to measure. But just listen to 300 to 900. Yeah. Women have 30 to 50. We're not driven by the same kind of spontaneous sexual desire. And we have it, certainly, but it's different. It's more nuanced, except in new relationships. It sparks up.
Right. Yeah. But, sex binging in new relationships.
Exactly.
Right? Exactly.
But if we're talking about longer term relationships, this will happen. A number of years ago, we sort of turned our thinking. We used to have a category called hypoactive sexual desire disorder for women. Now,
gracious, say that again.
Hypoactive, less than active, right?
Uh-huh.
Sexual desire disorder for women, right? It no longer exists because we realized in looking at the criteria for that diagnosis that many women, most women, maybe all women, at least points of time in their life, would qualify for that diagnosis. Well, that's ridiculous, So since the new millennium, we've really looked at female sexuality very differently than men, and we've begun to get much more information about this. So one of the theories is that women most often have sex for non-sexual reasons. They do it because it's just time in my relationship. I'll make him happy. I know I'll feel better when I'm done. It's kind of emotional reasons, kind of that's what you were indicating.
Yes.
So we tell people that that's normal, and we teach the partners, husbands or boyfriends, partners, girlfriends, whoever, the partners, that that's all true, and so that they're not expecting something, again, that expectation. Therefore, what we do is try to realize that what will happen in a positive sexual relationship is they'll become engaged for emotional reasons, but once you start touching and doing all those things, you begin to get aroused. And hopefully at some time the arousal builds and builds and builds, and now you've got desire. Please don't stop,
right.
And hopefully achieve orgasm as a result. So that becomes the positive sexual message. How we help all women, because men can have it too, but women particularly, how we help them is to think of sex as a meditation. By meditation, what we mean is meditation means sort of clearing the mind of all that chatter.
Yes, all those buttons.
Right. And in most meditations, they use breathing to do it. Yeah. So every time your mind wanders, you focus back on your breath. Mm-hmm. So we teach people how to do that, but focusing back on the body, staying in tune with the sensations in your body. So we teach people there's two places to be in your mind. One is in the sensations in the body. The other one is in a good sexual fantasy. And so we have to also help people have permission to have fantasy in sexual relationships. That can be a good fuel as well.
I can see myself saying to my grandchildren, Poppy and I have to go meditate for a while.
There you go.
And then we'll be back.
There you go. Perfect. And that's exactly what you'll be doing. Because in a way, if we have a good sexual experience, we're in that moment, which is what meditation's all about.
Yes.
For a few minutes, we're in that moment. We're not thinking about those other things. But we often have to train ourselves to do that and quiet that mind. So we give people exercises, actually, to do that.
Very important. I like that a lot. Mm-hmm. Truly do. Feeling sexy. And you talked also about fantasiful images. Mm-hmm. What kinds of discussions do you have that might involve both partners? Mm-hmm. Does the man need to say, oh, yes, I would like to have her wear, I don't know, a nurse's uniform?
Right. The standard. Yeah.
Yes.
Sure. I mean, sure, you can certainly do that. Talk about fantasies. You have to be careful. I mean, it can be dicey topics for some couples who aren't comfortable sharing these things. So it's not going to be every couple. We're going to have to be very careful about traversing that territory. But in couples who feel fairly open to talking about it, we can certainly use that as part of their sexual fuel. We even do things sometimes in couples such as we assign them, you're supposed to have some kind of sexual contact once a week on a scheduled basis, okay? And then maybe once a month or once every 6 weeks, kind of whatever fits into your schedule, you take turns planning a sexual event. And it could start out with dinner. I mean, it could, a romantic dinner or something if that's your bent. Or it could start out with laying some clothes out and having the person wear that clothing or whatever. Within reason. We always say, it has to be within reason. But we ask the other person to go along with it unless there's some reason where it's really not going to work for them. We have to be careful with those kinds of things. But if you feel pretty open to talking about some of our fantasies, it can be very helpful in sexual relationships.
What reactions have you gotten from people who have watched or read the book 50 Shades of Grey?
Yeah, it's all over the place, of course. Some people are embarrassed to tell you they did it. Other people think it was the best book ever and, hot and so forth. I think there's some interesting things about it. Fairly recent research on married women, when you ask them about their 2 top sexual fantasies, these are longer-term married women. The first one was sex with a stranger. The second one was somebody who overpowered you or overcame, not exactly the whole BDSM, bondage, discipline, sadomasochism kind of relationship that was depicted. But interestingly enough, 50 Shades of Grey depicts a type of sexual fantasy that we know is very, very key for women, believe it or not. And it's not the bondage, discipline, sadomasochism. Here's what it is. Okay. If you do content analysis on erotic literature for women, the romance novels, 50 Shades of Grey being one, you look at the themes, and in those themes, it's almost always the same theme. There's a woman who's pretty powerful in her own right. Anna was accomplished and smart and attractive and all kinds of things. But then you get the male character in that heterosexual erotica. It has to be pretty powerful, either incredibly handsome, Christian Grey, or rich, he's a billionaire, president, a king, or something like that. But here's the catch. It's that's the setup. But the catch is he wants her. He doesn't want anybody else. He doesn't want her prettier girlfriend. In the first book, it's all about why doesn't he want my prettier girlfriend? He wants me. So the catch is he wants me. So we know, in theory, in female sexuality, one of the biggest single turn-ons is it's almost narcissistic. I want to be the object of attraction. I don't want it to be somebody else. I want it to be me. And,
ladies, I hope you're listening to this. This is valuable information for us.
Yeah, so it's very interesting. It really is.
Yes.
Yeah. If you think about it that way, that's something we can kind of play on in women's sexuality if that's the kind of fantasy that helps to fuel their own sexuality. Female erotica can be very important. Some people love the book, some didn't. But there's others if they didn't like that one. And we sometimes make recommendations for women to read women's erotica.
I think that it's important that we do redefine intimacy, because I think there is that assumption if intimacy does not end up including sex and particularly intercourse, then we're not being intimate. I find this, I specialize with metastatic breast cancer patients who are certainly not able to engage in intercourse and have fatigue and talk about vaginal dryness because we have removed every bit of estrogen in them, and most of these women are in their 30s, so it's a very tough road to hoe. But I talk with them about redefining intimacy, that it may be just holding hands. And for these women that have got a lot of bone metastasis, we can't even hug them because we could break them.
Sure.
But for have them look at this in a different way. At our last metastatic breast cancer couples retreat, a question came up which literally knocked my socks off. One of the patients that was there, and these are small groups, just 12 patients and their 12 spouses or partners. So the women were in the room with me. The men and partners were in a separate room with a different facilitator. And one of these women said, I want to know if any of you others have done this or not. I've given my husband permission to have sex with someone else as long as it's a stranger and that he doesn't form a relationship with her. But frankly, I would be so devastated if he was doing that. I don't know how I'd deal with it. Mm-hmm. And 2 other women said they had done the same thing. Mm-hmm. They also had the same anxiety. Mm-hmm. And would be trying to figure out, is he or isn't he? Mm-hmm. And then in the other room, the husbands were saying, I don't know if she's got metastasis to the brain or what's going on, but can you imagine your wife telling you it's okay to cheat on her when she is so ill? I'm not thinking about any of that. I'm just thinking about how much time do I have left with her? And so when we put the 2 back together, a lot of crying, a lot of hand-holding, a lot of hugging, a lot of relief. Mm-hmm. But communication, I think, is what fails us, including with sex lives and sexuality and intimacy.
Absolutely. So there's that expectation that she expects that all he wants is sex from someone. And she can't give it in the traditional way.
Exactly.
And here he's thinking about something altogether different. That's beautiful. That's exactly why communication makes so much difficult. We spend, even though we do, forms of sex therapy, it becomes so much about couples therapy and mostly about communication, so those are the kinds of things that make all the difference in the world. I'm working, in fact, I saw this couple this morning as well, interestingly, but they just had a baby. They brought the baby. It was like a week and a half old or something. Beautiful.
Little baby.
Little.
Wow.
Anyway, so they're experiencing a lot of difficulty in being, again, overtly sexual prior to the birth and now afterward. That's a lot of what we're talking about. It's not just making sure they have ample opportunity for touch that can be appropriate. As you're saying, that's not even hugging necessarily, but at least hand holding or something where, because touch is important for bonding and continuing bonding, but also for that ability to communicate what the frustrations are and so forth, because they'd had some infidelity years ago, this couple in their relationship, and she's very worried that he doesn't find her attractive. She's put on weight. She can't have sex right now, all of that. So, again.
Well, I'm glad they seeked you out. I think that gives me optimism for them
there.
Knowing that they said, we want professional help.
Yeah, exactly. Yeah. So any of these formats, whether it's therapy, whether it's groups for people who discuss these things, anything like that could be helpful. And, there are good, if you're not that, there's certainly good things online. There's good reading materials about this, sorts of things. There's a wonderful book by, really touted in my field, called Come As You Are, by a woman named Emily Nagoski. And come as you are. You don't have to be anything particularly sexually, come as you are. And she gives you some wonderful kind of down-to-earth, again, advice on this. There are resources out there.
I was looking at restroom doors, and the symbolism right on the door is a woman wearing a dress. The only time that is a symbol of a woman is on a daggone restroom door. All of the other symbols of women is seeing if her silhouette shows that she has breasts or not.
Yes.
I don't know what we need to do to convert over for more restroom images, but I sure do wish that we could. Now, I am going to be buying a sign to go in my house on my guest bathroom door that shows the traditional woman in the skirt and a mermaid. Because I collect mermaids. I saw that it could be a mermaid's
bathroom. Could be a mermaid
too.
Instead.
Yes.
That's great.
Thank you so much for joining us today. This has been very informative, and I know that our audience is taking notes and benefiting from your very wise words of wisdom. And hopefully there'll be some gals out there that will reduce their buttons, as well as plan some date nights and start looking at sex in a more optimistic way.
Thank you very much.
Thank you for listening to A Woman's Journey podcast. Join me, Kelly Gear-Ripken, your host, Lily Shockney, and a variety of Johns Hopkins experts on the first Thursday of each month to learn about medical advances in women's health. A Woman's Journey is grateful for the unrestricted educational grants from BioSense Webster, Boston Scientific, and Keswick Wise and Wellness Center that support our podcast series, Insights That Matter. For more information about A Woman's Journey, visit our website, hopkinsmedicine.org/A Woman's Journey, and like us on Facebook and Twitter. Until next time, stay well.